High-potency iron is a type of iron supplement that is used to address low levels of iron in the blood, a condition commonly caused by anemia or pregnancy. Iron is a crucial mineral that the body requires to produce red blood cells and maintain overall health. It is recommended to take this supplement as directed by a healthcare professional, typically with a glass of water and on an empty stomach. The daily dosage and optimal timing for taking this supplement may vary depending on individual needs, so it's important to consult with a healthcare provider for personalized guidance. Make sure to follow the instructions on the product package or as directed by your doctor. Do not exceed the recommended dosage. If you have any questions, consult your doctor or pharmacist. Iron is absorbed best on an empty stomach, usually 1 hour before or 2 hours after meals. If it upsets your stomach, you can take it with food. Avoid taking antacids, dairy products, tea, or coffee within 2 hours before or after this medication as it may decrease its effectiveness. Take tablets or capsules with a full glass of water, unless directed otherwise by your doctor. Do not lie down for at least 10 minutes after taking your dose. Swallow extended-release capsules whole and do not crush or chew them. If you are taking chewable tablets, chew them thoroughly before swallowing. If you are taking a liquid suspension, shake the bottle well before each dose. For adults taking the liquid form, carefully measure the dose using a special measuring device. Do not use a household spoon. If giving the liquid drops to an infant or child, use the dropper provided to measure the dose. The dose can be placed directly into the mouth or mixed with food as directed. It is best to give this medication right after a meal. Take this medication regularly at the same time each day to get the most benefit from it. Some common side effects of high-potency iron may include constipation, diarrhea, stomach cramps, or upset stomach. These effects are usually temporary and may go away as your body gets used to the medication. If any of these effects persist or worsen, it's important to contact your doctor or pharmacist. High-potency iron may also cause your stools to turn black, but this is not harmful. It's important to remember that if your doctor has prescribed this medication, they have determined that the benefits outweigh the potential risks. Many people using this medication do not experience serious side effects. While rare, a very serious allergic reaction to this drug is possible. Seek medical help right away if you notice any symptoms of a serious allergic reaction, such as rash, itching/swelling, especially of the face/tongue/throat, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so if you notice any other effects not listed, be sure to contact your doctor or pharmacist. As for the optimal timing and dosage, it's best to follow the instructions provided by your doctor or pharmacist. They can advise you on the best time to take this medication and the appropriate daily dosage for your individual needs. It's important to keep high-potency iron supplements out of reach of children, as accidental overdose can be fatal. If you suspect an overdose, seek medical help immediately or contact a poison control center. High-potency iron supplements are commonly used to treat or prevent iron deficiency anemia. They are also used by pregnant women to support the increased demand for iron during pregnancy. The recommended dosage for adults is typically 100 to 200 mg per day, taken with a glass of water or juice. It's best to take iron supplements on an empty stomach, but if you experience stomach discomfort, you can take them with food. It's important to note that high-potency iron supplements can interact with certain medications and should be taken at least 2 hours apart from other medications or supplements. Always consult with your healthcare provider before starting any new supplement regimen. Before taking high-potency iron, it's important to let your doctor or pharmacist know about any allergies you may have, as well as your medical history, especially if you have iron overload disorder, liver problems, or stomach/intestinal problems. If your iron supplement also contains folic acid, make sure to inform your doctor if you have a vitamin B12 deficiency before taking it, as folic acid may falsely improve certain lab tests for vitamin B12 deficiency without actually treating the anemia. Chewable tablets of this medicine may also contain aspartame, so if you have a condition that requires you to restrict your intake of aspartame, consult your doctor before using it. Liquid preparations of this product may contain sugar and/or alcohol, so if you have diabetes, alcohol dependence, or liver disease, make sure to ask your doctor or pharmacist about using this product safely. If you're pregnant, High-potency iron should only be used when clearly needed, so be sure to discuss the risks and benefits with your doctor. And if you're breastfeeding, consult your doctor before taking this medication. Drug interactions can impact how your medications work and increase your risk for serious side effects. It's important to keep a list of all the products you use and share it with your doctor and pharmacist. This includes prescription and non-prescription drugs, as well as herbal products. Do not start, stop, or change the dosage of any medicines without your doctor's approval. High-potency iron can decrease the absorption of other drugs such as bisphosphonates, levodopa, penicillamine, quinolone antibiotics, thyroid medications, and tetracycline antibiotics. It's important to separate your doses of these medications as far as possible from your doses of high-potency iron. Ask your doctor or pharmacist about how long you should wait between doses and for help finding a dosing schedule that will work with all your medications. It's best to avoid taking this medication at the same time as antacids. Wait at least 2 hours between taking high-potency iron and an antacid. If your brand of iron also contains folic acid, be sure to tell your doctor or pharmacist if you take certain anti-seizure drugs. Lastly, this medication may interfere with certain lab tests, possibly causing false test results. Make sure lab personnel and all your doctors know you use this drug. If you or someone you know has taken too much high-potency iron and is experiencing severe symptoms like passing out or difficulty breathing, it's important to seek medical help immediately. You can call 911 or the Poison Control Center for assistance. In the U.S., you can reach the Poison Control Center at 1-800-222-1222, and in Canada, you can call a provincial poison control center. Symptoms of an overdose may include stomach pain, nausea, vomiting, and diarrhea. It's crucial to get the necessary help in such situations. If your doctor has prescribed this medication, do not share it with others. Your doctor may also recommend lab and/or medical tests, such as a complete blood count, while you are taking this product. It's important to keep all medical and lab appointments and consult your doctor for more details. Remember that this medication is not a substitute for a proper diet. It is important to maintain a well-balanced diet that includes foods rich in iron, such as red meats, especially liver, fish, beans, dried fruit, and iron-fortified/enriched cereals and bread. If you forget to take a dose of high-potency iron on your prescribed schedule, take it as soon as you remember. If it's almost time for your next dose, just skip the missed one and take the next dose at your regular time. Do not take double the dose to make up for the missed one. When it comes to storing high-potency iron, it's important to keep it at room temperature, away from light and moisture. Make sure not to freeze liquid forms of this medication and avoid storing it in the bathroom. Always keep all medications out of reach of children and pets. When it comes to disposing of high-potency iron, it's important to properly discard it when it's expired or no longer needed. Be sure to consult your pharmacist or local waste disposal company for the best way to do this. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.